Hello everyone, I am Dr. Debjani Mukhopadhyay, consultant gynecologist and gynecological oncology unit lead at Barking, Havering and Redbridge University NHS Trust. My passion is to work on cancer prevention, and what best topic than cervical cancer, which is a preventable disease. On this occasion of Cervical Cancer Prevention Awareness Week, let's understand how we can prevent it. Although it impacts women, men too have an important role to play. To begin with, where is the cervix? The cervix or neck of the womb is the tail end of the womb or uterus. A part of it protrudes in the vagina, and this is where the smears are taken from. Certain facts that we should be aware of about cervical cancer. First, it is a preventable disease, so it is under our control to treat it. It is most commonly found in women between the ages of 35 to 45, and there is a second peak between 50 to 55 years. It affects less than 1% of women in the UK and claims about 800 deaths per year. In India, it claims about 60,000 deaths per year and is the second biggest killer of women after breast cancer. Many cervical deaths probably go unrecorded. Why is this difference? It is because many countries do not have a robust cervical cancer screening program. In UK, there is a robust cervical cancer screening program with a national register. It involves smears to be taken 3 yearly in women between the ages of 25 to 50 and 5 yearly in women between the ages of 50 to 65. No smears are needed beyond the age of 65. The smears detect abnormal cells in the cervix before they become cancer. There are probably cervical cancer screening programs in developing countries too, but no infrastructure to implement it nationwide in a systematic way with quality control. Why is there an overall poor uptake of smear tests in women? Probably fear and lack of knowledge. Let's see what is to be expected in a smear test. The whole test takes about 15 minutes or less. Here's an example of a comfortable couch on which you are to sit. It moves up and down and tilts to make it comfortable for both you and the person taking the smear. Once you are comfortable on the couch, a speculum is inserted into the vagina to view the cervix. This is the speculum, and the hand is there to give an idea of the size. This is a normal sized speculum. If the normal size speculum is too uncomfortable for you, especially in older women, there are also small sized speculums. Please do not make the discomfort of 5 minutes an excuse not to get a smear test. On my right hand is the smear brush, and on my left hand is the plastic replica of the cervix that is seen by the doctors. We insert the brush gently into the cervix and rotate it 5 times. This lasts only about 15 seconds.
Yeah.
This is a different type of brush that goes all the way into the cervix to get the cells from within the cervical canal. This is not used routinely, but only in some cases. Once the smears are taken, the brush is inserted into a plastic bottle with special liquid and sent to the lab with correct labeling. In the lab, the cells are centrifuged and looked under the microscope. We also look for the HPV virus parts. The results confirm the presence or absence of HPV, and if HPV is present, it also shows the appearance of the cells, which can range from normal to borderline, mild, moderate, severe, glandular changes and suspicion of cancer. Women who are negative for HPV repeat the smear in 3 years. Women who are positive for HPV or have abnormal cells, they should attend a colposcopy clinic. The colposcopy clinic is a prevention clinic that looks at the cervix with a microscope to detect any abnormal cells. If the changes noted are low grade, we usually keep a watchful eye, but sometimes may take a biopsy to confirm it. If the changes are high grade, then a loop cone biopsy is offered. Some moderate changes can be managed conservatively. What to expect in a colposcopy clinic? There is a comfortable couch like the one for smear test. The speculum is inserted like when the smear is taken. A special liquid is applied to the cervix and the doctor examines the cervix via a microscope to look for any abnormal areas. A biopsy may be taken, and if changes are high grade, a loop cone biopsy may be performed with your consent. Now let's look at what causes these abnormal changes and cancer of the cervix. HPV or human papillomavirus causes most of these abnormal changes and cervical cancer. It is a very common virus present in about 80% of all sexually active people. The good thing is that we can get rid of it with good immunity. It thrives in women with a weakened immunity, like those who have HIV, lupus, on steroids, and had transplant surgery. There is very strong evidence that smoking causes cervical cancer. The other causes are starting sexual activity at a young age, having many sexual partners, or having a sexual partner who has many sexual partners, and starting to have children at a young age. What are the symptoms that should alert us to get ourselves checked for a cervical cancer? Any abnormal bleeding during or after intercourse, bleeding in between periods, bleeding after menopause, unusual vaginal discharge, discomfort or pain during intercourse, and if sexually transmitted diseases have been excluded via swabs but the symptoms still persist. There is a lot of information here. What you need to remember and act are the following. Do the smear test at least every 3 years. Stop smoking. Use the cervical cancer vaccine appropriately. Use condoms as it offers protection against HPV. Request for a smaller size speculum if discomfort with a normal sized speculum. Men have a critical role to play too. As men, you can educate your loved ones and ensure they have access and help them to act on it. So, men, women, and the healthcare professionals have to work together. And together, I do believe we will beat cervical cancer. Thank you for your valuable time. Hope it has given you a clear understanding on prevention of cervical cancer. If you like this video, please like, share, subscribe, and provide your feedback.